Welcome back, everybody. As kids settle into summer break, mental health experts say this can be a really important time for parents and caregivers to check in. More than 1 million Texas children reportedly experience mental, emotional, or behavioral challenges. And Integral Care is offering free youth mental health first aid training to try to help adults recognize warning signs and then know how to respond. Joining us today is Jeff Richardson, CEO of Integral Care. Thank you so much for being here.
Thanks, Avery. Appreciate the interest. Thank you.
So talk about why summer break is such an important time for parents and caregivers to pay special attention to a child's mental health.
Yeah, that's a great question. I think it's hard for kids to start thinking about going back to school right now, but this is a time of year where families start preparing for the upcoming year ahead. It's a time for parents to kind of check in with kids because it's a little bit more unstructured. It's an opportunity to spend a little bit more time with kids when you're on vacation and other places. But we also really see this as an opportunity for parents to have that one-on-one conversation with kids that you very often don't have. And as you noted earlier, and we've seen here based on CDC data, is that really 1 in 3 kids is struggling with a mental health issue. And in fact, the CDC just finished a survey that said 1 in 3 high school students reported that their mental health was not as good most of the time in the past 30 days. So there's a lot of kids that are struggling. And so this is a great opportunity for parents to check in, family, friends, to really check in and see how their kids are doing. That but often parents, family member, community folks don't know how to talk to their kids, and that's really why that's at the heart of the mental health first aid training that we provide.
So talk to us a little bit more about that term, mental health first aid. What does that really mean? What practical skills can parents and caregivers learn?
Yeah, I think that's great. I think what we found, and actually Integral Care has actually trained 20,000 folks here in Central Texas in mental health first aid. It does a couple things. First, one of the things that's very often, we don't always know how to talk to kids and adults about when they're struggling with a mental illness. So, or they're just not feeling good or they're feeling down. It is a hard conversation to have. And sometimes the very first people who will see these problems are our friends and family. So it helps family members, folks who aren't mental health professionals, learn how to talk to their family members about what's going on. Secondly, it helps folks identify what those issues are. It helps practice and develop the skills to be able to communicate with your kids. And then lastly, when to know when to get help and what those resources are. If somebody is struggling with something more than a bad day, how do we get help and how do people connect to care?
So many good tools to have in the tool belt. I do want to ask about that. When a parent or a caregiver is maybe worried that something has verged or gone beyond, typical teenage behavior, typical struggles, to maybe something more serious, anxiety, depression, and a real mental health issue, to seek professional help. Are there any warning signs or maybe a tipping point that a parent should be on the lookout for if they haven't yet taken this mental health first aid training?
Yeah, Avery, that's a great question because I think we all know our kids pretty well, and when you see really changes in their behavior, someone who's very lively and active, starting to isolate themselves and not talk, not sleeping, not eating, or really just a change in their ordinary patterns of behavior. And if it starts to affect your kids or your friends' daily functioning, that's when it becomes a time for someone to seek professional help. Um, and one of the things that we have found is that when we're able to help kids early and often, that allows them not to have more severe challenges down the road. So mental health is like any health condition. If we're able to treat and support folks early, we're able to prevent more intensive needs down the road.
So if folks are hearing this and they are interested in signing up for this training, give us some quick details here. Where can they go and what can they expect?
Sure. Our next training is coming up August 19th. So put that on your calendars, and you can actually sign up through our Eventbrite page, which is on our website, integralcare.org, and be able to connect with us there. You can also find out more information about that training, also how to access care if you or your family member is in a crisis. We have our hotline that's 24/7 that you can speak to somebody. We also manage the 988 call center for 70 counties across Texas. So if people want to use the 988 number, if it's a crisis, can do that as well. But I would encourage people to go to our website and learn a little bit more about it. But if you have any questions whatsoever, you can certainly call our helpline and we're happy to assist.
Awesome resources. And we want to remind folks that mental health training is free as well for parents, so parents and caregivers. So Jeff Richardson, CEO of Integral Care, thank you so much for being with us today and for the work you're doing here in Central Texas.
Thank you so much, and hope everyone has a wonderful, healthy, and mentally health summer. Thank you.
We appreciate it. Such good reminders. You know,